So I just want to say that I'm particularly pleased with the Hemophilia Council's focus on highlighting the impact of the pandemic on one's mental well-being, because it really shows that this group gets it. They get the connection between physical health conditions and mental health. So what now? Where do you look if you need help? If you've thought, okay, I get it. There's something going on. That screen earlier that had the faces and the indicators. I think that something's going on with me or a family member. What do I do? How do I seek the help? So I'm going to try to, for the remainder of this presentation, share a little bit about resources. So first of all, it's important to find a behavioral health professional. Ask a friend, ask a clergy member, a physician, or dial 211. In any county, you should be able to access 211 and find out where to go for services. Also, call your health plan and go to their website and also put in the search term behavioral health. So whether that's going to the website or making a direct call, you can receive information about coverage. And so I wanted to just share some screenshots with you to just be really practical. Where do you look? Well, look, on the left, that's a screenshot of Anthem's website. Literally, you can, on the click down menu, hit behavioral health, and it'll bring up providers and coverage. And then on your insurance card, here's a photo of an insurance card. You'll see I circled behavioral health services, the number to call, and also paying attention to the prior authorization as well. So these are really practical things, right? You've got this in your pocket or your wallet or a file at your house. So that's an initial place to look and try to get services. And hopefully when you make that call, you're met with services, right? Someone's responding, they're telling you where to go and where to get help. Also, if you have Medi-Cal, you want to look at your Medi-Cal card. That it should also have a place that's pointed out in terms of where to go to for behavioral health services. But what happens if you're told there's no provider? We don't cover that service. Sorry. We can't do that. Well, you need to know your rights too. Many people, try to access the system and then they get a response that's not favorable and they give up. The message that I want to send you today is don't give up. Keep moving forward. And so you can do things like file a grievance. I know that sounds like a big thing, but it isn't. There are ways to go into the system, request paperwork to file a grievance. The form is not too typically difficult, but what you need to know is that health plans and others have what are called network adequacy requirements. And this means that they need to provide service timely and close to your home. So within a certain amount of your initial request for services, those plans have to respond within a certain time period, and they have to show you everything that's available for you. Also, Medi-Cal, if you ask, can provide transportation many times to appointments. So if that's an access barrier, okay, they told me where someone is, but it's not, I'm in a county and this is the only, this is the closest service, but I can't get to it, or I don't have a car, or it's difficult. Ask through Medi-Cal if you can get transportation. Also ask the health plan what they offer too. Don't be afraid to ask. And then many private insurance companies will offer gas reimbursement. So even if they can't offer you, an Uber or any type of transportation that they've contracted, they may be able to reimburse you for gas too, but you have to ask. They will not upfront just tell you these things. That's why I'm telling you these things. So make a note to yourself. If you run into trouble, that you can ask for these things. It is your right. And if they tell you, well, no one's in network, sorry, we don't have anybody, request out of network. That is actually your right. If they can't provide you someone within their network who's able to provide services close to your home and in a timely fashion, then you can request somebody further out. What's really important about this is that you should not have to pay more in terms of co-pays for someone that's out of your network. So the same price that you would have paid in network, and I put here on the screen, let's say it was $25, but they say, oh, we don't have anybody, and the copay is $100 for out of network. You are still able to pay that $25 that would have been charged to you if you found somebody within the network. It's not your fault. They don't have someone within network. So I just want to make sure that people understand that you should not be holding the bag at the end of the day for what the health plans, insurers, etc., should be taking care of. All right, now, what happens if it's a crisis? Something is really, really bad, falling apart. number one, call 911 if it's that type of emergency. But also if it's a crisis and you have some time and can get to a counselor, hopefully, or someone or a hospital, if you have the right intervention, call 211. Call 211. 211 is kind of like back in the day, it was 411 when I was growing up. That's the number you call to get information. 211 is the kind of local services information, and they should also be able to tell you where you can go for crisis services, for behavioral health services, et cetera, in the case of an emergency. Also, there's something called the National Suicide Prevention Lifeline. Now, just because it says suicide prevention does not mean that they don't handle other types of crises as well. So you can call this number. It is now called 988. There's a federal law that was just passed that all states have an active 988 line. It's kind of like the 911 for any type of emergency. Now 988 is specifically for behavioral health emergencies. So if there's a behavioral health crisis, this is the new 911 for behavioral health. So you call 988 and they will pair you with somebody who's an expert in dealing with crises. So if you or a family member is having a behavioral health crisis, call 918, speak to a crisis counselor who can then make an appropriate referral and link you where to go. So these are some of your just kind of like in the moment options, don't know what to do. This is a crisis, so you don't have time to look on that website or sit on hold with the health plan or whatnot, or the Medi-Cal number. Call 211, call 988, get immediately routed to someone that can provide you with in the moment help. And what they tend to do is they release mobile units if you need help. So they can have a mobile unit come to your home and provide you with on-the-spot emergency treatment for a behavioral health condition if necessary. So it's just important to know these options if you're in a crisis. If you're not, you can go through the steps and try to sign up and get an appointment with a counselor, and hopefully it will be timely. And if not, I just told you, you can file a grievance. But if it's a crisis, don't wait, get it addressed. All right. Now, if it's something that's also severe and you think needs long-term services, it's important to know what's also available to you. So, Medi-Cal and health plans can provide intensive outpatient services, which means really, like for instance, day intensive programs where you don't just go for one session, but you're there maybe for an all day and getting a lot of different services there. You can also qualify for home-based services. So you might be able to have folks come into your home to provide you with care there if needed. Then there's residential treatment where someone's actually staying, overnight in a facility, or hospitalization as well. So there are an array of services open to you if you are a Medi-Cal beneficiary, and also if you have private insurance as well. So just wanted to share those as well. So who's paying for all this, right? These are great treatments, but who is really paying for it? So if you have private insurance, you want to look, and here's just this one's actually from Texas. I couldn't find a California one, sorry, but it would look very similar. And this is the explanation of coverage that you'll find for your private insurance. So you want to go and flip through the pages. This one, I think in total was about 4 or 5 pages, and it had all kinds of services. As you can see, emergency room, urgent care, it had physical therapy, speech language, all kinds of stuff. And then here it has serious mental illness, mental health care, treatment of chemical dependency. And this is what you want to look at. You want to figure out, what are my benefits? What's covered? What's not? And as you see here, it says 80% of allowable amount after the deductible is covered, and after the calendar year, et cetera. So you can look at your explanation of coverage. You should also be able to pull this offline. So if you have health insurance, you should be able to log in online and pull that up, or you can call the number on the card to figure out what your coverage is. Let's see. Also, you need to know that there are several laws that require the insurance to cover certain services, even if they say they won't. Unfortunately, I've seen too many patients run into a situation where they call, they're told, oh, I'm not covered, I'm not covered. No, don't stop there. For example, health plans must, in California, they must cover mental health and substance use disorder services at the same level as physical health services. This is referred to as, you may have heard the term parity. That means like equality in many ways, right? So just know that if your plan is telling you, well, we don't offer that level of coverage, that by law, they have to offer that. And if they're not, then you can file a grievance with the health plan. Again, we mentioned grievance earlier, or you can also call the Department of Managed Healthcare in the state. It's a number, it's a process, but there are people like, I would think, the Hemophilia Council and other organizations that can help you in this, kind of navigate that system that you may have to deal with. So now, if you have Medi-Cal, it's important to know that specialty mental health services, they are the responsibility of your county, of county mental health. So it'll start off with, you'll probably get an assessment by the county, then they will determine if you qualify for services and which ones you qualify for. Now, if you disagree with the county and say, no, I think I should be getting these services, just like you do with the health plans, you can also appeal. There's an appeal process with the county. And the Department of Healthcare Services is the state entity that oversees Medi-Cal for the county. So just as the Department of Managed Healthcare is a state entity that oversees everything having to do with insurance plans, for Medi-Cal, it's Department of Healthcare Services. So it's just two different entities, but there's always going to be a state entity that oversees it that you can appeal to. Know that that is your right for sure. And again, use the resources around you. There's also several like legal groups that provide assistance in kind of walking through an appeals process as well. So you can Google that. And last night I Googled it and there was lots of different, ones that popped up. So you want to make sure that you use what's at your disposal to get the free legal advice to walk through that process. Hopefully you won't have to. Hopefully you'll call, you'll get your appointments, they'll be timely, they'll be close to you, and maybe they'll provide gas reimbursement or a ride to the office. But if not, you need to know that you do have rights. Don't give up is the plan. Also, local self-help and support groups are really, really important too. Maybe it's not a crisis that is as deep as suicidality or, psychosis or something that's really needing some immediate attention. But know that there are other ways that you can get the help you need, whether that's, groups for patients and families, whether that's Alcoholics Anonymous, community groups are all over the place too. You can definitely Google and find those. And then NAMI too. NAMI is a really good, the National Alliance Mental Illness. It's a great organization that focuses on patients and their families and getting them resources and support they need. And that doesn't always look like formal, therapy or psychological services or anything like that. Sometimes it's just more low-level support, but just know that those resources are there for you. Also, I mentioned that I represent behavioral health agencies across the state. So on the CBHA website, there's a list of our members. So you can see where mental health agencies are located at across the state that we represent. That's another good resource for you for sure. And some of these mental health agencies aren't just Medi-Cal contractors. They also, many of our agencies also work with health plans. And so there are options on both sides of the continuum as it relates to services provided. All right. And then I also wanted to include some screenshots of some useful publications that will help you navigate the system. So this first one is from NAMI. And it's called Navigating a Mental Health Crisis. And I really like it because it just breaks it down, makes it really easy. And as you see here, like any other health crisis, it's important to address mental health emergency. So the guide, as it says, outlines what can contribute to a crisis, kind of gets you to kind of think about, is this a crisis? Is this something that needs immediate help? And if so, what do I do in the moment to de-escalate, right? To keep everyone safe. And then what are my immediate resources? And I covered a few things you can do, call 988, call 211, but this guide is really great too. And I included links to all of these. So, if the PowerPoint is distributed later, you can click on those links and then check out these really good resources. Also really want to lift up this other resource, Navigating the Currents, and this is the California Association of Local Mental Health Boards and Commissions article or publication here, and it really serves as a guide to what the public mental health system looks like in California. And that's important because it can be confusing. Who has time to read through all that? I mean, I work in advocacy in Sacramento, and I still don't have enough time to do the bedtime reading to understand the system completely, and things are always changing. So that's why this is so nice, because it allows you to kind of get a quick and dirty and an understanding of what the system really looks like in California if you're interested and want more information. Here's another one by the National Health Law Program. This publication focuses again on navigating Medi-Cal specifically. So this is important too, if you're a Medi-Cal recipient or have benefits, to understand what's going on there, the laws, your rights as a patient. So just also wanted to provide this to you. So I think that all these resources are super useful, and I really encourage you to use them. Again, you can call the Department of Managed Healthcare to file a complaint if you're running into trouble with private insurance. And you could also call the Department of Healthcare Services if you're having issues with Medi-Cal. Hopefully it doesn't have to get to that point, but just know that there are options there. And then I also want to acknowledge, in this day of technology and telehealth, that there are some things that are helpful. I think sometimes self-help applications and whatnot get a bad name. I'm a psychologist, so obviously, I believe in treatment and counseling and all of that, but I also know that technology can be helpful, particularly for certain populations. We've seen during the pandemic that youth are really responding really well to technology. Others are not. I've seen older adult populations who find it really difficult to use and maybe not as easy to navigate or friendly as having somebody face-to-face. That might be their preference. And obviously working with children is difficult. You can't do that over, telehealth if you're trying to do play therapy really well. But there are some useful apps. And so I just wanted to point these out. And I think I also want to provide the caveat that there are lots of things out there, right? Not everything's good. As with anything, not everything's good. So I am going to show you a few apps, a couple lists of apps that I think are good, and they're based on a review that's done at the University of California, San Francisco. They have kind of vetted these, and so I wanted to show you what they're proposing could be helpful for folks. Here we go. So in terms of kind of lower level, self-help apps, there are some that you can actually engage with a counselor, which is neat. You could actually have sessions, and others it's just about getting yourself centered. So Headspace, you may have seen commercials on this. You get like a 2-week trial for the general public. And what's nice about these two is as UCSF chose ones that were free, of no cost, that you can download on your phone, doesn't cost you anything, but you can try these out. So Headspace, Calm, I've seen a lot of commercials on that too. I stop when I see that commercial because I have 2 kids, 2 and 4, 2 little boys who are just raucous. And so we all stop and listen to the Calm commercial. I should probably download it myself. I need it. There's other little things like Stop, Breathe, and Think. There's an insight timer. So there's a lot of different things you can try out. If you need it or want it, pick what's best for you. But these things are free. They're available on your cell phones. So check it out. Mindfulness Coach as well. That's another good one that I've seen. So I included the link at the bottom here to the page at UCSF, which lists all these. You can click on them and see a lot of different resources there as well. And then I also wanted to highlight these apps that they are recommending for more clinical issues, right? So if I'm an anxious person, or I have depression, or I'm really experiencing a ton of stress, who isn't during this pandemic, by the way? These are apps that you might want to check out. And it gives you really good information, like that this was it's using clinically validated techniques, or some of them have licensed mental health professionals. Most of these are free, if not all of them, I think. And there's other things like Mothers and Babies online course. I have little kids, like I just mentioned. So, and many of these are in different languages as well. So that's also something that's important. And then there's one thing I thought was really neat. It's called COVID Coach. It says created for everyone to support care over mental health, your overall mental health during the pandemic. I think we all need to just click on COVID Coach and get through the rest of this week. But, I think this is important, particularly when we are isolated. Those things are opening up. The truth of the matter is, when things open up, it's not, I don't think it's ever going to be business as usual. I think it's going to be a different way of doing business for sure. And so when you think about your health and your behavioral health, it may be a different way of, monitoring and taking care of that as well. And I think that we cannot assume that when things just kind of go back to normal or go back to whatever they're going to be, that we're going to be the same people, that we're going to react the same ways to things, that we're going to feel a certain way. Nobody, for the most part, anticipated this kind of lockdown for a year. And the impacts of it can be really, really, they can be really tough, as we all know. And so being able to have resources at your disposal as you come out of the pandemic, maybe you're thinking, I'm just going to go back to work and be fine, or I'm going to do this, and you realize, something's up. This isn't like, I'm not transitioning back well. It's good to have some basic information here and some resources for your utilization. And then there's even one I put at the bottom on insomnia, right? People have had sleeping issues. And again, sometimes that's a sign or symptom that there's something happening with you biologically, chemically, with your brain, with your mental well-being that might be worth looking at. So again, just wanted to bring these up because I thought it's practical and it's real and it's easy to download and check these out. This might be your starting point. You might realize something's up. Maybe I then need to use the resources that were shared during this presentation about seeking out a referral or going directly to a behavioral health clinician, or if it's a crisis, calling 211, calling 988, getting what you need for sure. All right, so all in all, I really hope that I've impressed upon you in this brief presentation the importance of focusing on maintaining healthy mental well-being during this pandemic and beyond. Let's not make assumptions about how we're going to feel when everything opens up. You just never know how it's going to impact you and your family. So be ready, and don't be scared. Utilize your resources to, do whatever you need to do in terms of an appeals process or pushing back against the system. I know I make it sound so easy. It's not necessarily, but you do have help. You do have resources. You just have to know about them. And most important, as the quote on the screen reads, you are not alone, not alone, not alone. Now more than ever, we need to find ways to stay connected with our community. So I hope that this is helpful in raising awareness around some of the issues as it relates to behavioral health, health plans, Medi-Cal, getting services, engaging in the appeal process, and really just taking care of yourself one day at a time. Thank you.
Thank you, Dr. Clark-Harvey. We did have one question that popped up in the chat while you were presenting. We talked a bit about, Medi-Cal and private insurance. Some of our community is on CCS or GHPP, which would similarly provide services similar to Medi-Cal. But if somebody doesn't have Medi-Cal or private insurance, do you have any suggestions how they might approach getting services if they don't have insurance coverage?
So I would say, Medi-Cal. Medi-Cal's, it's available, right? It doesn't discriminate. So I would apply for Medi-Cal. And if you don't know where to start, call 211. Say, who do I call? How do I get signed up? They will direct you to where to go. Now, obviously, if you're in a position where you don't have Medi-Cal or private insurance and you're able to pay out of pocket for services, there's definitely, as with any health industry, there are professionals that are out there that will provide services many times on a sliding scale fee, meaning that they'll say, what's your situation? What can you pay? In some communities, there are barter arrangements where goods and services are exchanged for treatment. So it's important to know that clinicians actually I'll speak for psychologists, have an ethical responsibility to provide services if they can. And they are allowed to do bartering and they are allowed to do sliding scale fees. And it's just good clinical practice. So sometimes if you, for whatever reason, maybe you just don't want the paper trail or whatever, and you feel like you have the means or resources, there are people out there that provide private services and you won't have to go through insurance at all.
Yeah, and I would just add to that for those that aren't familiar with it, the Medi-Cal application in California is a combined application with Covered California. So you can, and I actually think you have a few more days, right? Because I think it's through May 15th that the Covered California enrollment period is open right now. So it's a combined application. Medi-Cal applications don't close at all, but you can, it's one application and they'll let you know if you qualify for Medi-Cal. And then if you don't qualify for Medi-Cal, you might qualify for subsidies under Covered California and be able to, and they'll let you know what is available to you if you do that application. So if you don't have coverage, you may be surprised that you have quite a few options here in California to get coverage, which would then help you both with, physical medical issues as well as the behavioral health and the mental health issues. Wanted to let folks know that we do have a couple of webinars coming up in the coming months. In June, we're going to be talking about telehealth. In July, we're going to be discussing, how you manage with managed care in in California. And then we're going to be talking about the roadmap to keeping yourself insured in August. So, you know, some of those questions even that folks had about what to do about insurance, we may be addressing in additional upcoming webinars. And so I want to thank our webinar series sponsors, and we appreciate their support in making this possible. And I thank all of you guys for joining us today. Thank you so much, Leandra, for being with us and for your presentation and all this great information. And we look forward to seeing everyone next month. Thank you. Thank you all for joining us. Bye-bye.